After the age of 75, the human body undergoes many major changes, increasing the risk of chronic diseases and dangerous complications. According to statistics, most deaths in this age group come from a number of common causes, which can be prevented or slowed down with a healthy lifestyle and appropriate preventive measures. So, what are the 7 leading causes of death in the elderly, and how to protect health and prolong life? Let's find out in the article below. 1. Cardiovascular disease, myocardial infarction and stroke. Cardiovascular disease is one of the leading causes of death worldwide. Of these, myocardial infarction and stroke are 2 dangerous conditions that can lead to serious consequences if not detected and treated promptly. 1. Causes of myocardial infarction and stroke. Myocardial infarction and stroke often occur due to blockage of arteries by atherosclerotic plaques or blood clots. The main causes include atherosclerosis. Fat and cholesterol accumulate in the artery walls, narrowing the arteries, obstructing blood circulation. High blood pressure puts pressure on the artery walls, increasing the risk of blood vessel rupture. Diabetes. High blood sugar can damage arteries. Smoking damages the artery walls and promotes blood clot formation. Obesity and sedentary lifestyle increase the risk of cardiovascular disease. Chronic stress contributes to high blood pressure and damage to blood vessels. 2. Symptoms of heart attack and stroke. Heart attack, angina, feeling of squeezing in the chest, pain that spreads to the arm, shoulder, neck or jaw, shortness of breath, sweating, nausea, dizziness, fainting. Stroke, face distorted, unable to move normally, weakness of an arm or leg, especially on one side of the body, difficulty speaking, loss of ability to communicate, dizziness, loss of balance or loss of consciousness. 3. How to prevent cardiovascular disease. Control risk factors. Monitor and control blood pressure, cholesterol, and blood sugar. Get regular health checkups to detect cardiovascular problems early. Healthy diet. Eat plenty of vegetables, fruits, fish, and foods rich in fiber. Limit saturated fat, fast food, and processed foods. Reduce salt intake to control blood pressure. Drink plenty of water and limit alcohol. Exercise regularly. Maintain an exercise routine of at least 30 minutes/day, 5 days per week. Exercises such as walking, swimming, yoga, or cycling are very beneficial for the heart. Limit alcohol and quit smoking. Alcohol can increase blood pressure and damage the liver, which is harmful to the heart. Smoking increases the risk of atherosclerosis, causing heart attacks and strokes. 4. Conclusion. Heart attacks and strokes are dangerous diseases, but can be prevented through maintaining a healthy lifestyle. Controlling risk factors, eating a healthy diet, exercising regularly, and avoiding bad habits will help protect your heart and brain, improving your quality of life. 2. Cancer in the elderly. Causes, prevention, and screening. Cancer is one of the leading causes of death in the elderly. The aging process increases the risk of cell mutation, which leads to the development of malignant tumors. Some common cancers in the elderly include lung, colon, prostate, breast, liver, and stomach cancers. However, many preventive measures can help reduce the risk of disease and improve the quality of life. 1. Causes of cancer in the elderly. Aging is the most important factor that increases the risk of cancer due to weakened immune system. As age increases, the ability of the immune system to destroy mutated cells decreases, creating conditions for cancer to develop. Accumulated DNA damage. Cells in the body are constantly damaged by factors such as environmental pollution, chemicals, radiation, etc. Over time, damaged DNA cannot be completely repaired, leading to the risk of cancer. Hormonal disorders. In women, hormonal changes after menopause increase the risk of breast cancer and endometrial cancer. In men, an increase in prostate size can increase the risk of prostate cancer. Unhealthy lifestyle. Smoking, drinking alcohol, an unbalanced diet, and lack of exercise also contribute to an increased risk of cancer. 2. Common cancers in the elderly. Lung cancer, mainly related to smoking, polluted environment, and exposure to toxic chemicals. Colon cancer, common in people over 50 years old due to a diet low in fiber, high in red meat and processed foods. Prostate cancer, common in older men due to hormonal changes and genetic factors. Breast cancer, increased risk in postmenopausal women due to hormonal changes, family history, and unhealthy lifestyle. Liver cancer, common in people with a history of hepatitis B, C, heavy alcohol use, or cirrhosis. Stomach cancer, related to a diet high in salt, fermented foods, H. pylori infection, and genetic factors. 3. How to prevent cancer in the elderly. Regular cancer screening. Elderly people should perform cancer screening tests as directed by their doctor. Lung cancer. Low-dose CT scan if there is a history of heavy smoking. Colon cancer. Regular colonoscopy from age 50 and up. Prostate cancer. PSA test in men from age 50. Breast cancer. Mammogram every 1 to 2 years from age 40 to 50 depending on risk factors. Liver cancer. Ultrasound and AFP test if at high risk. Stomach cancer. Gastroscopy if there is a history of stomach ulcers or H. pylori infection. Healthy diet. Limit processed foods. Reduce red meat, fast food, foods high in fat, salt and sugar because they increase the risk of cancer. Supplement foods containing antioxidants. Green tea contains EGCG, which helps fight the growth of cancer cells. Turmeric is rich in curcumin, which has anti-inflammatory and anti-cancer properties. Green vegetables such as spinach, broccoli are rich in fiber and vitamins that help protect cells. Berries, blueberries, strawberries are rich in anthocyanins which help prevent cancer. Maintain a healthy weight and avoid obesity. Obesity increases the risk of many types of cancer such as breast, colon, uterine, and liver cancer. Maintain a balanced diet. Control calories and exercise regularly to maintain a healthy weight. Exercise regularly. Exercising for at least 30 minutes a day helps boost immunity, reduce inflammation, and limit the risk of cancer. Activities suitable for the elderly include walking, yoga, swimming, and light cycling. Quit smoking and limit alcohol. Smoking is the main cause of lung, laryngeal, and esophageal cancer. Drinking a lot of alcohol increases the risk of liver, nasopharyngeal, and colon cancer. Control stress and get enough sleep. Prolonged stress can weaken the immune system, creating conditions for cancer to develop. Get enough sleep 7 to 8 hours a day to help the body regenerate cells and maintain good health. 4. Conclusion. Cancer is a major concern for older adults, but it can be prevented by maintaining a healthy lifestyle, regular screening, and controlling risk factors. Proactive healthcare will help improve quality of life and prolong life. 3. Alzheimer's disease and memory loss in the elderly. Aging is a natural process that everyone must go through. As age increases, the body and brain are also affected, leading to memory loss and the risk of neurodegenerative diseases, especially Alzheimer's disease. This is one of the main causes of dementia in the elderly, seriously affecting the quality of life. 1. Causes of memory loss. Memory loss can be caused by many factors, including natural aging. As we age, the brain gradually loses its ability to process information and remember. Accumulation of beta-amyloid protein. This is the main cause of plaque formation in the brain, damaging nerve cells and leading to Alzheimer's disease. Nutritional deficiencies. An unbalanced diet lacking important vitamins and minerals, such as vitamin B12 and omega-3, can impair brain function. Underlying diseases. High blood pressure, diabetes, and high blood fat can all affect blood flow to the brain, increasing the risk of memory loss. Lack of exercise and little brain stimulation. People who rarely participate in intellectual and physical activities are at higher risk of developing the disease. Sleep disorders. Insufficient or poor quality sleep negatively affects the brain's regeneration and recovery process. 2. How to prevent memory loss and Alzheimer's disease. Although Alzheimer's disease currently has no complete cure, we can apply many measures to slow down the process of memory loss and maintain brain health. A. Maintain the habit of learning and stimulating the brain. Regularly read books and learn new skills to keep the brain active. Play chess, crossword puzzles, Sudoku, or other brain games to stimulate thinking. Participate in communication activities and groups to increase social interaction. Reduce the risk of depression and isolation. B. Build a healthy diet. Add foods rich in omega-3 such as salmon, mackerel, sardines to improve brain health. Use nutritious nuts such as almonds, walnuts, chia seeds to help protect nerve cells. Eat lots of green vegetables and fruits containing antioxidants to reduce the risk of brain aging. Limit the consumption of foods high in sugar, saturated fat, and processed foods to avoid brain inflammation. C. Control blood pressure and blood sugar well. Have regular health checkups to detect blood pressure and diabetes problems early. Maintain a healthy lifestyle. Limit salt, sugar, and unhealthy fats. Exercise regularly to help blood circulation and maintain stable blood pressure. D. Maintain quality sleep. Get enough sleep from 7 to 8 hours every night to help the brain recover and process information effectively. Limit exposure to electronic screens before bed to avoid affecting melatonin. Create a comfortable, quiet sleeping space for deeper sleep. 3. Conclusion. Alzheimer's disease and memory loss are serious problems that the elderly often encounter. However, by maintaining a healthy lifestyle, eating scientifically, and stimulating the brain regularly, we can slow down the process of memory loss and protect mental health effectively. The elderly and their families should proactively take preventive measures early to improve the quality of life. 4. Chronic obstructive pulmonary disease, COPD, in the elderly, causes, effects, and prevention. Chronic obstructive pulmonary disease, COPD, is a group of lung diseases that obstruct airflow, reducing respiratory function. This is a progressive disease that can cause many dangerous complications if not well controlled. The elderly are at higher risk of COPD due to decreased lung function over time and cumulative effects from the living environment. 1. Causes of COPD. COPD is mainly caused by long-term lung damage from the following factors. Smoking. This is the leading cause, including active smoking and passive smoking. Toxic substances in cigarette smoke cause inflammation and damage to lung tissue over time. Environmental pollution. Regular exposure to polluted air, fine dust, toxic gases from vehicles, factories, or wood stoves can also cause lung damage. Exposure to chemicals and occupational dust. People who have worked in environments with a lot of dust, industrial chemicals, or smoke from burning coal or wood are at higher risk. Genetics and age. Some cases of COPD are related to genetic factors, especially alpha-1 antitrypsin deficiency. In addition, older people are at higher risk of developing the disease because lung function declines over time. 2. Symptoms of COPD in the elderly. COPD often progresses slowly and may not be recognized early. Some common symptoms include persistent shortness of breath, especially with exercise or exertion, chronic cough with thick phlegm, often appearing in the morning, wheezing or feeling of tightness in the chest, Feeling tired. Weak due to lack of oxygen to the body. Unexplained weight loss if the disease has progressed severely. If not treated promptly, COPD can cause serious complications such as respiratory infections, respiratory failure, or right heart failure. 3. How to prevent COPD in the elderly. To reduce the risk of COPD or prevent the disease from progressing, the elderly should take the following measures. 1. Do not smoke and stay away from secondhand smoke. Quit smoking immediately if you are smoking. Limit exposure to secondhand smoke from people around you. Promote in the family to create a smoke-free environment. 2. Maintain a clean living environment. Avoid exposure to polluted air, dust from vehicles or coal stoves, wood stoves. Use a mask when going out to protect the respiratory tract. Maintain a well-ventilated living space. Limit dust and smoke in the house. 3. Practice breathing exercises and maintain an active lifestyle. Practice breathing exercises such as abdominal breathing, pursed lip breathing to increase gas exchange. Participate in gentle physical activities such as walking, yoga, or meditation to improve lung function. Avoid a sedentary lifestyle. Maintain a moderate lifestyle and proper nutrition to increase resistance. 4. When to see a doctor. Elderly people should see a doctor immediately if they have symptoms such as increasing shortness of breath, not improving with rest, prolonged cough with thick or bloody sputum, frequent chest pain, fatigue, dizziness, blue fingertips or lips. COPD cannot be completely cured, but can be well controlled if detected early and treated properly. Elderly people need to follow their doctor's instructions to maintain the best quality of life. Conclusion: chronic obstructive pulmonary disease, COPD, is a serious health problem for older adults. Awareness of the causes, symptoms, and prevention will help reduce the risk of developing the disease and minimize complications. Protect your lung health now by quitting smoking, keeping your living environment clean, and maintaining a healthy lifestyle. 5. Falls and fractures in the elderly. Causes, consequences, and prevention. 1. Causes of falls and fractures in the elderly. Falls are one of the leading causes of fractures in the elderly. After age 75, the body undergoes many changes that increase the risk of falls, including osteoporosis. Bones become brittle and break easily due to gradual loss of bone density with age. Impaired balance. The nervous system is less sensitive, muscles weaken, reducing the ability to maintain balance when moving. Osteoarthritis. Degenerative joints make walking difficult, making it easy to slip and fall. Poor vision. Eyesight is poor, and it is easy to stumble because they cannot recognize obstacles. Side effects of drugs. Some drugs used to treat blood pressure, sedatives, and diabetes can cause dizziness, increasing the risk of falls. Unsafe living environment. Slippery floors, stairs without handrails, and lack of light can easily cause the elderly to lose balance and fall. 2. Consequences of falls in the elderly. Falls not only cause pain, but also seriously affect the health and quality of life of the elderly. Bone fractures. The most common fracture sites are the hip, wrist, femur, and shoulder. Hip fractures are especially dangerous because they can lead to loss of walking ability. Dangerous complications. Bone fractures can cause infection, bed sores, venous thrombosis, pneumonia, and even death. Loss of confidence and fear. After falling, many elderly people become anxious and lose confidence when walking, leading to reduced mobility, which weakens muscles and increases the risk of falling again. 3. How to prevent falls and fractures. Supplement calcium and vitamin D for strong bones. Calcium. Necessary to maintain bone density, reduce the risk of osteoporosis. Elderly people should supplement from milk, yogurt, cheese, seafood such as salmon, shrimp, crab, almonds, chia seeds, sesame seeds. Vitamin D helps the body absorb calcium better. Sources include morning sunlight before 9 a.m., fatty fish such as salmon, mackerel, mushrooms, eggs, animal liver, exercise to increase flexibility and balance, yoga and Tai Chi, improve flexibility, help the body maintain better balance, reduce the risk of falling, light walking, maintain muscle strength, strengthen the skeletal system, leg and back muscle exercises, help improve body control when moving, adjust your home to ensure safety, install handrails on stairs and toilets to support movement, avoid slippery floors, use anti-slip mats, dry the floor immediately when wet, ensure adequate lighting, especially on walkways and stairs to help the elderly see better, arrange furniture properly, avoid placing objects that block the way, reducing the risk of tripping. Conclusion: falls and fractures are serious problems for the elderly, but they can be completely prevented with a reasonable diet, regular exercise, and safe living environment. Take care of and support your elderly relatives to help them live healthy, confident, and reduce the risk of falling. 6. Infections and pneumonia in the elderly. Causes, risks, and prevention. 1. Introduction. Elderly people are at high risk of infections, especially pneumonia and urinary tract infections. This comes from a weakened immune system, making the body susceptible to attacks by bacteria and viruses. If not treated promptly, pneumonia and infections can lead to dangerous complications, even death. Therefore, it is very important to recognize the causes, signs, and preventive measures. 2. Causes of infections and pneumonia in the elderly. Weakened immune system. As age increases, the immune system works less effectively, reducing the ability to fight bacteria and viruses. Underlying diseases. The elderly often have chronic diseases such as diabetes, cardiovascular disease, chronic obstructive pulmonary disease, COPD, kidney failure, etc., which increase the risk of infection. Respiratory system weakness. Lung function declines with age, combined with lack of exercise or prolonged lying down, causing mucus to accumulate, creating a favorable environment for bacteria to grow. Unhealthy living habits. Drinking little water, not keeping the body warm, poor personal hygiene, and poor nutrition weaken the immune system. 3. Symptoms of pneumonia and infections in the elderly. Pneumonia and infections in the elderly may present differently than in younger people, sometimes not clearly. Signs to watch out for include high fever or low fever that lasts, dry cough or cough with phlegm, difficulty breathing, rapid breathing, chest pain when breathing deeply, fatigue, loss of appetite, confusion or sudden changes in consciousness, pain when urinating, cloudy urine or strange smell, for urinary tract infections. 4. How to prevent pneumonia and infections in the elderly. White heavy checkmark: get vaccinated. Annual flu vaccination helps reduce the risk of viral infections that cause pneumonia. Get vaccinated against pneumococcus to prevent pneumonia caused by Streptococcus pneumoniae bacteria. Get vaccinated against COVID-19 to reduce the risk of serious complications if infected with the virus. White heavy checkmark: maintain healthy living habits. Drink enough water. Helps thin mucus, avoid dry throat, and increase the ability to eliminate bacteria. Keep your body warm. Especially in cold weather, you need to wear enough warm clothes. Avoid sudden exposure to cold wind. Wash your hands regularly. Helps prevent the spread of bacteria and viruses. Good personal hygiene. Brush your teeth at least twice a day. Change clothes regularly and keep your living environment clean. White heavy checkmarks: strengthen your immune system with proper nutrition. Supplement vitamin C. Oranges, lemons, red bell peppers help increase resistance. Eat foods rich in protein. Meat, fish, eggs, milk to help the body recover faster. Use foods containing zinc and selenium, found in seafood, cashews, Pumpkin seeds to strengthen the immune system. Avoid foods high in sugar and fat. Weaken the body's ability to fight bacteria. White heavy checkmark, maintain physical activity. Gentle exercise such as walking, yoga, qigong helps the lungs function better. Take deep breaths every day to improve lung function. White heavy checkmark, get regular health checkups. A general health checkup helps detect early signs of infection. If you have any unusual symptoms, you should see a doctor immediately for timely treatment. 5. Conclusion. Pneumonia and infections are serious problems for the elderly. However, by getting vaccinated, maintaining a healthy lifestyle, eating a balanced diet, and getting regular health checkups, we can significantly reduce the risk of getting sick. Take care of your health and the health of the elderly in your family for a healthier and happier life. 7. Kidney failure in the elderly. Causes, consequences, and prevention. Kidney failure is one of the serious health problems commonly found in the elderly. The kidneys play an important role in filtering out harmful substances, balancing water and electrolytes in the body. When kidney function declines, harmful substances accumulate in the blood, causing many dangerous complications. 1. Causes of kidney failure. There are many causes of kidney failure in the elderly, the most common of which are high blood pressure. High blood pressure damages the small blood vessels in the kidneys, causing the kidneys to gradually lose their ability to filter blood effectively. Diabetes. High blood sugar can damage the kidneys over time, reducing their ability to eliminate toxins. Unhealthy diet. Consuming too much salt, processed foods, and harmful drinks can increase the burden on the kidneys. Uncontrolled use of drugs. Some pain relievers or anti-inflammatory drugs can be harmful to the kidneys if used for a long time without consulting a doctor. Natural aging. As age increases, kidney function also declines, increasing the risk of kidney failure. 2. Warning signs of kidney failure. Early-stage kidney failure often has no obvious symptoms, but as the disease progresses, the elderly may experience the following signs: fatigue, lethargy, loss of energy, swelling in the legs, ankles, and face due to water retention, less urination, foamy urine, or discoloration, back pain in the kidney area, on both sides of the waist, long-term high blood pressure, loss of appetite, nausea, difficulty sleeping. If you have these signs, you need to see a doctor immediately for timely diagnosis and treatment. 3. How to prevent kidney failure. Elderly people can proactively protect their kidneys with the following measures. Drink enough water. Drink 1.5 to 2 liters of water per day, unless otherwise directed by a doctor. Avoid drinking too much carbonated soft drinks, alcohol, and caffeinated drinks. Limit salt and processed foods. Reduce salt intake to less than 5 g/day, about 1 small teaspoon. Limit eating canned foods, fast foods, fried foods with lots of oil. Increase eating green vegetables, fresh fruits, and foods rich in fiber. Control diabetes and blood pressure. Elderly people with diabetes and high blood pressure need to follow their doctor's treatment regimen. Maintain a reasonable weight, eat healthy, and exercise gently. Walking, yoga, meditation. Regular health checkups. Have your kidney function checked at least 1 to 2 times a year. Check your blood pressure and blood sugar to detect early risk of disease. 4. Conclusion. Kidney failure is a dangerous disease, but can be prevented if the elderly maintain a healthy lifestyle, control underlying diseases well, and have regular health checkups. Protect your kidneys today for a healthier and happier life.